Hi, I'm Chris Wise with Wise About Flower Mound, and I am here with Dr. Margaraet Apostol, and we are at this beautiful yoga room, which, oh my gosh, so a yoga room in your doctor's office. So tell me about your business.
So I'm a family physician, I'm an MD doctor, and I've always had a passion for nutrition and health and wellness.
Yes.
So, when I went to medical school and I did my residency, I clearly found out that we were not focused on health. It was really about disease management.
Yes.
So I took it upon myself. I did the training as typical medical training. Even worked in primary care for about 7 years. And then I kind of pulled the trigger and made the switch and focused more studies on nutrition. I have a bachelor's in nutrition, so I always thought I could use that in my medical degree. And I've done a fellowship in integrative medicine, and I've done functional medicine training through the Institute of Functional Medicine. So with all that, you know, here we are in this practice. We've been around for about 1.5 years now.
Okay, great.
And really we focus on wellness, nutrition, lifestyle changes, which unfortunately in modern medicine is really not talked about or emphasized.
Right.
So we're not opposed to prescription drugs. We're just trying to find ulterior ways or better ways in improving our health.
Exactly.
Yes.
And that, I mean, gosh, we're not going to get into anything about the pharmaceutical industry, but you think about it, there's more money in the disease than there is in the cure. And so why would they want to cure you?
Correct.
Sorry about that. But just, you know, but it is sad. We could do so much for ourselves by eating the things that God intended us to eat.
Correct.
And, exercise and do all of those things.
Correct.
And have a much fuller life because of that.
Yes.
And just because you have inflammation, all those, autoimmune, all those things that you hear people talk about, you got to get to the root. So it sounds like that's what you're going for.
That's exactly, and that's what functional medicine is the root cause. So we don't treat the symptoms because that's Band-Aid treatment.
Yes.
We ask, why are these symptoms happening? And then we use either a very detailed history, diagnostic testing to try to get to that root cause. And it's kind of like an onion. There's multiple layers. It's very complex. It's not straightforward.
Yeah.
You can always go see a conventional doctor and get medications. Anyone can do that, but we spend a lot more time with our patients because the body's complex and there is that mind-body connection, so we take that into consideration. So there's more to the person than what kind of meets the eye and on paper. And we can have 2 different people with the same exact medical problem, but we treat them very differently because each person is so unique.
Yeah, that's true. That is so true. And I didn't think about all of that, but as I'm starting to become more aware of that and realizing that just because you have high blood pressure, diabetes, those kind of things, there's some things that you can do that really help with inflammation. I think that's one of the biggest things that people don't think about.
Yes.
I personally have an inflammation problem, and so I've been looking at ways that I can minimize that and really bring that back into a more normal, natural state.
That's right. That's right.
Yeah.
And we find that chronic inflammation, prediabetes, elevated sugar, even toxicity. People don't think of environmental toxins, heavy metals, mold, chronic infections with Lyme disease, Epstein-Barr. There's all these other things that can affect someone's personal health that modern medicine kind of puts away. It doesn't really look into. And with speaking with my conventional colleagues, they with their training and the training they've done, they do their best, and a lot of this is outside their training. So, when you're coming to kind of looking outside the box, you do have to seek a functional medicine trained provider if you're looking for more of a well-rounded approach. Right,
exactly. Yeah. So you said you're a GP, or do you do like just general family practice kind of stuff too?
I'm starting to. When we first started, it was just functional medicine consults, but now I'm doing more primary care because we can offer even sick visits. So if someone has the flu, strep throat, even COVID testing, we started doing that here. So, it's hard to separate functional medicine and primary care. Really, medicine is just medicine. Right. And you're just doing good medicine.
You're taking care of the patient.
That's right. That's right. Yes.
Okay.
Yes.
So you accept insurance, or how does that work usually?
So we don't accept insurance. We are a cash practice.
Okay.
And the reason for that is we did try to take insurance last year, And the insurance companies do not see what we do as standard of care.
They handcuff you.
They handcuff you. They would not pay for anything.
Yeah.
I mean, we were trying to keep the lights on, if you can imagine, and getting just a few pennies for spending 2 hours with a patient.
Yeah.
So we made that difficult decision. But sometimes doing a cash model is a little bit more cost effective, because we're finding that patients are paying very high deductibles, they're paying very high copays.
They would have had to pay anyway.
Exactly.
Yeah.
And our patients can use their HSA card if they'd like.
Okay.
We even produce a super bill, so we put diagnosis codes. If they want to submit to insurance, they can get reimbursed.
Okay.
So that's always an option.
Okay.
Yeah.
Well, and that's good. And you're right, with a lot of people having those high deductible plans, you know, a lot of that stuff is not covered at all.
Correct.
Just, you know.
We even do blood work cash. I mean, we can do a basic blood panel for $5.
Oh, wow.
So sometimes it's more cost effective to just pay cash and not go through the insurance route.
Exactly.
Yeah.
There was a while where we were on one of the Christian health plans, and so a lot of that we paid for ourselves, you know, until it got to a certain threshold. And I was shocked at how much more budget friendly the cash pay price was compared to what they were going to charge insurance.
That's right.
And
that's right.
I won't get onto that.
Yes,
but
yes.
I do have my feelings about all of that, but I won't go there. But so that's so exciting. So, gosh, why would somebody call you? So you're experiencing something, or you just? I mean, so tell me about that.
So most of the people that come to see us have seen other doctors, and they are kind of in a dead end. So they've either had these symptoms that have been unexplained. Testing is all normal, so that I get that a lot. But yet they have these very concerning symptoms and even debilitating symptoms, and they don't have an answer. And so coming to us, we really dig deep. So some of the things that we can do, in addition to just regular blood testing like most doctors do, is we can do a detailed nutrient testing. So sometimes if there's nutrient deficiencies, that could cause problems. We can do gut testing. So now, you know, kind of this new trend is gut health or leaky gut.
Yes.
We do stool testing, and we can check for overgrowth of bad bacteria that might produce inflammation. Because now we know 90% of our immune system's in our gut.
Exactly.
So if our gut is inflamed,
is messed up, we
can have autoimmune disease, even depression, psychiatric disorders, I mean, you name it. We also do toxicity testing. So if you're really wanting to see if there's heavy metals, there's mold, environmental toxins, people don't think about that at all. I mean, we are in constant contact with environmental chemicals all day long. I've tested many people who have elevated BPA levels, you know, the plastic chemical that can cause some mental fogginess.
I've got some fogginess every now and then. Yes.
And I would say the other big thing we do is hormone testing. A lot of women, especially women with hormonal imbalances, and we deal a lot with thyroid issues, estrogen dominance. I have a lot of women that are young with breast cancer because of estrogen dominance. So we really work with them to detoxify all those excess estrogens, balancing hormones, even postmenopausal women. We're trying to balance those. So that's kind of like the majority of what we do. Another thing we do, it's a very special niche, is we work with Alzheimer's or cognitively impaired people.
Really?
So our dementia patients, they're not all dementia is Alzheimer's. And we work with Dr. Dale Bredesen, who wrote, he's a New York Times bestseller. He wrote the book, The End of Alzheimer's. He's in San Francisco, but we've partnered with him, and we do a program called RECODE, which stands for Reversal of Cognitive Decline. And so people think, well, once you have dementia, it's a death sentence.
Right.
You can't do anything about it. But we can actually find there are different kinds of dementia. There's 6 types of dementia, and by doing blood work, on a very thorough history, even genetic testing to see if they have the component, the genetic component, we can find underlying factors and try to either halt the active dementia and then potentially reverse it. And we've had improvement in dementia symptoms and cognitive symptoms subjectively and objectively through lab testing.
So, wow. So if somebody's like, I mean, I guess at what point does it become dementia? So is it, oh, I forgot why I went into the room. That happens all the time. But I mean, so like at what point would somebody seek you out for that?
Oftentimes people seek us too late.
Yeah,
you know,
that's
because
what I was thinking.
most people do the same thing. They forget their car keys, they forgot why they walked in the room, they kind of brush it off, senile dementia. But we do cognitive testing, so we do it two ways. We do something called a Montreal Cognitive Assessment Test, so that there's an objective measure. The other test we utilize is something called EVOKE, and this is actually a brain cap, and it's an EEG machine, and we can measure brainwave activity, and we can see if there's any dementia. So there's two ways.
Wow.
And then we do very extensive lab testing. We work and we do this RECODE program per se. It's a very intense program. There's a lot of lifestyle changes involved. The earlier, the better.
Right.
So we have all spectrums from mild to severely impaired. You know, with dementia, the course of the disease is that if you do nothing, they will decline. So sometimes success is just preventing that decline and keeping them where they're at.
There. Okay.
But we've had objective improvement with some of our patients, and it's really the amount of work that they're willing to put in, their support system, because of course there's social barriers depending on their age and you know, whatever is going on in their life. It's an intense program. So that's kind of a special niche that we do. It's almost probably half our practice with these dementia patients.
Oh my gosh.
Yeah.
Well, I know. I mean, I've had very dear friends who have had family members with Alzheimer's and dementia, and that's just, it's so sad.
It's very
to
sad.
see that progression and just feel helpless. I mean,
but there's so much we can do, and that's not the message that medicine is conveying. They just tell family members, get your affairs in order. Good luck to you. Here's some Namenda or Aricept. We hope you do fine. I mean, they're not going to do fine. They usually decline pretty rapidly. And most of my patients don't have the genetic component of Alzheimer's, but yet they have dementia. So we're finding there's chronic inflammation, there's elevated glucose or sugar, even toxicity. So there's a lot of factors that are involved, and there's a lot of investigation work to get to that underlying root causes. What is the underlying factor here? And most often than not, it's more than one thing.
Right. Okay.
Yeah.
So if somebody maybe, you know, they're forgetful, so they could do that CAP test and then figure out, is it going to be a long, like, oh gosh, you're headed down a path, or no, you just need more vitamin something?
That test will help differentiate that, because that CAP, it's called EVOKE, it can pick up dementia even before the patient has symptoms.
Oh, wow.
Yeah.
Okay.
Yeah. So it's really a great device, and again, it's objective, so we can't make it up. Someone can't cheat on it.
Right.
They just, you know, do the test. It's about 14 minutes long, and then we get a really interesting report.
Interesting.
Yes.
Wow.
Yes. Yes.
You know, there's some people I'd love to put that cap on, but that's a whole nother thing. That's exciting. So, gosh, so you see people all like, so genders and ages and everything.
Yes.
Okay.
So as a family physician, I did pediatrics, but for the sake of this practice and this niche, I'm trying to focus on 14 years old and up.
Okay.
But I can see under 14 years old on a case-by-case basis, really depending on, you know, whatever it is.
Yeah. Okay.
Yeah.
Great.
Yeah.
Wow. Well, that's exciting. You've got a beautiful place here.
Thank you.
I mean, this is really nice and just very serene. Of course, we're in the yoga room, so that makes makes you very serene.
Yes.
But so it's been wonderful to get to know you and get to know your practice here in Flower Mound. And we're just right over in the doctor's offices next to the hospital. So very easy, great location, and so come and see Dr. Margaraet Apostol.
Thank you.
And, you know, for functional medicine, because that is something I think people are starting to realize, that we need to get to the root cause of things instead of just popping those pills and treating the symptoms and not really treating what is actually deep down that's causing you the problem. And a lot of things, that chronic stuff, I mean, fatigue and those kind of things are because of, you know, I point to the gut. A lot of it is in the gut. So you got to fix that. You got to fix the inflammation and fix those things so that you can have definitely a healthy and well-rounded life. So thank you so much. I appreciate this. And once again, I'm Chris Wise with Wise About Flower Mound, and we'll see you next time.